The purpose of the Foley catheter: continuous drainage of the bladder, a way to let your urinary system rest after surgery as you return to normal urinary function, and to prevent a trip to the ER after your surgery due to inability to urinate. This orange tubing is your Foley catheter that was placed by your surgeon during your procedure. The catheter tubing could be orange, green, or clear, but for the purposes of this educational video, the catheter tubing will be orange. Starting from the left is the tip of the catheter. This is where urine enters. Next is the inflated balloon. This inflated balloon secures your catheter inside your bladder. You may have 2 or 3 ports depending if continuous bladder irrigation was used in the recovery room. This is a 3-way Foley catheter that has 3 ports. The top port is used to inflate the balloon to keep the catheter in place. You will not need to do anything with this port. The middle port is connected to the drainage bag or leg bag. This port will be used to change between your leg bag and drainage bag, since this is where your urine will collect. Finally, the bottom port has the yellow plug. This port was originally connected to the irrigation system. While you have your Foley catheter, this yellow plug should remain in place. This is a 2-way catheter. Similar to the 3-way catheter, the tip on the left is where the urine enters the catheter. This catheter is also secured by an inflated balloon. The main difference is that there are only 2 ports instead of 3. The top port on the right is used to inflate the balloon and keep the catheter in place. Again, you will not need to do anything with this port. The second port will be connected to a leg bag or drainage bag. In some rare instances, there may be a yellow plug if your surgeon wants you to self-drain. This is an example of the continuous bladder irrigation system. This was used during your procedure. The large bag of irrigation fluid entered your body through the irrigation port and flushed out your bladder. You will not go home with this system. The only time you will have this irrigation system set up is while you are in the recovery room and/or if you are admitted to the hospital after surgery. This is the thigh strap. This is used to secure the Foley catheter to your upper leg. This is the leg bag. The leg bag is secured with leg straps to the calf. The tubing is connected to the Foley catheter. This allows for urine to drain directly into the leg bag. At the bottom of the leg bag is the white spout to empty the leg bag. It has a light green cap to keep it covered when not in use. There is also a dark green handle that allows you to empty your leg bag. Here is the leg bag when it is secured to the leg. The benefit to wearing a leg bag is that it is more discreet and can be easily worn under clothing such as a pant leg. The leg bag should be used during the day while you are up and awake. This bag also needs to be emptied more frequently since it is smaller. Wash your hands with soap and water prior to emptying the leg bag to help prevent infection. Unsecure leg straps to remove the bag away from the lower leg for easy access. Remove the cap, pull down on the green handle on the spout, and empty into a designated container like a toilet. Avoid touching the end of the spout with your hands or any other surfaces. Return the green handle on the spout to its original position. Clean the end of the spout with an alcohol pad and place the cap back on the opening of the spout. Reattach the straps to your leg to secure your leg bag. When you're finished, wash your hands with soap and water. Wash your hands with soap and water prior to switching. Empty your current bag prior to switching to the new bag. Place a towel underneath the connection site between the orange catheter tubing and the clear tubing. Pinch the end of the Foley catheter tubing that is currently attached to the drainage bag and take the catheter apart by gently twisting. Do not pull the catheter. Attach the Foley catheter tubing to the tubing of the other bag to be used. Check to make sure that the connection is tight and then unpinch. Secure the bag in proper position below the bladder with appropriate straps and wash your hands. This is the drainage bag. This is a larger bag that is best used when sleeping and resting for long periods of time. It has a clip towards the top of the bag to hook onto your bed frame while you are lying down. The clear tubing connects to the Foley catheter. At the bottom of the drainage bag, you have the clear holder that holds the green plastic clamps. You also have the silver clamp. The silver clamp is used to drain the drainage bag. The drainage bag. Make sure to wash your hands with soap and water prior to emptying the drainage bag to help prevent infection. Pinch the green plastic clamp to remove it from its holder. Place the green tube and aim it towards a designated container like a toilet. Unclamp the silver clamp by pushing down on the tab and allow for the urine to flow out of the bag. Once emptied, reclamp the silver metal clamp by pushing down until you hear a click and it locks into place. Clean the end of the green plastic tube with alcohol and return the clear plastic holder on the drainage bag. Wash your hands with soap and water after emptying each time. Ensure that there are no kinks in the tubing from insertion to the drainage bag and that the bag is below the level of the bladder. Also, make sure that the catheter is secured properly. Wash around your catheter insertion area at least 2 times a day with soap and water, and wipe the Foley catheter downward from the insertion area. Check your skin around the catheter for signs of redness, tenderness, or swelling. Notify your doctor if you have any of these signs. Caring for your drainage bag when not in use. Soak it in vinegar and water solution, 1/3 cup of vinegar and 1 cup of water to clean the bag and reduce odor. Let it dry thoroughly prior to next use. Important things to remember. Do not wear a leg bag when you are lying down because the urine could flow back into your bladder and cause an infection. Always attempt to empty drainage bags when they become half full. Make sure that you perform proper hand washing before and after emptying. Avoid fitted underwear that may pinch off your tubing and may affect urine flow. Do not fasten the leg straps too tightly. Loosen straps if your leg feels numb or tingly, or skin becomes reddened or pale. Notify your physician or go to an ER if you have a fever above 100.6 degrees Fahrenheit or chills, if you have burning or pain in your lower stomach, if you have cloudy or foul-smelling urine, if you have bright red, bloody urine with or without clots that does not get better over time, if you have little or no urine flow, or if you have swelling, redness, or pain at the insertion area. Thank you for letting us be a part of your care. We hope this video helps you to better understand how to care for your Foley catheter. If you have any questions or need further clarification, don't be afraid to call your surgeon's office.